Hi, Dr. Turowski here. I would like to talk to you about the buttock augmentation. As we know, this is very popular now. Kim Kardashian, everybody talking about it, and people talking about it. A lot of people, women, of course, more than men, although there are some men, want to have a bigger buttocks. What happened recently, it's actually something that I would like to address. Brazilian buttock lifts, or BBLs, as they called popularly, are actually very dangerous. This is something that changed over the last few years, that we realized as a plastic surgeon that suddenly we have a spike in death, not complications, but in death from fat transfer to the buttocks. It doesn't address any other area. We don't have any problems with the fat transfer to the breast, fat transfer to the faces, but particularly to the buttocks. And why is that? Because buttocks have very large veins. These veins are located deep in the buttock area. They're not visible and then can be inadvertently injured and injected with fat. What happens next? The fat goes into the lungs and kills us. Very similarly to people diagnosed from coronavirus, they have a lung problem. People can get lung problems from the fat transfer to the buttocks. So in my practice, I stopped doing these procedures 2 years ago, completely. I don't want to deal with a surgery that has the highest incidence of death in plastic surgery. Just like any procedure has a risk, and the risk may be 1 in 50,000, 1 in 100,000, the buttock injections have an incidence estimated to be 1 in 3,000. That's much too much. We don't want to deal with it. So what can we do? In the past, when we are actually doing the buttock augmentations with the fat, I wasn't a big fan of the buttock implants, because the buttock implants have problems. They can have problems just like any implants can have problems. They can have infections, they can have malpositions, all these things can happen. However, they're rare and they are acceptable, but you cannot kill anybody with it. So that's the most important part. So I think that the risk of buttock implants is not very acceptable as compared to the BBLs, or Brazilian buttock lifts or fat transfers. It also addresses the group of patients that are skinny. They don't have enough fat. So even if you want to do this procedure with fat transfer, you really are not a candidate for that, because a lot of women that have small buttocks, they don't have fat to do that. So I suddenly found myself doing a lot of butt implants and other implants, and we can talk about it separately. Buttock implants are performed under anesthesia, too much pain to do it under local, through a small incision in the buttock crease. Then the implants are actually placed differently than the breast implants, which go under the muscle. The muscle in the buttocks is so thick that we actually can place these implants inside the muscle, with the coverage on top and below the implant, so that provides a better protection for the implant and better results. It's a quick procedure. It takes about an hour and a half. Limitations are very small. You can walk right away, and actually walking is good, and it's good for you. What you cannot do is sleep or sit on your butt for a couple weeks. Sleep probably for 4 or 6 weeks. Sit as little as you can for the next few weeks. And that's it. The complications, again, are rare. I actually, in my practice so far, didn't have any big complications for that, but obviously we discussed it during our preoperative discussions and consultations. And talking about that, if you are not in Chicago and you cannot come for consultation, send me your pictures. I can discuss your procedure over the phone, over the internet, and we can address it, give you an estimate, and you can come for the procedure here. We'll see you a day before, we discuss it, you have your procedure, go home, go to the hotel, and you can leave within a couple days.